Hello, my name is Dr. Stanley Lang, and welcome to this video, which is on the subject of how you can decrease your risk for cancer and for having a heart attack all at the same time. And the reason I wanted to share on this subject today was that I had so many different conversations with patients literally on this subject, which is the major factor which is driving the risk for heart attacks. And that major factor is having insulin resistance syndrome or metabolic syndrome. And this causes inflammation of the coronary arteries, which causes the cascade of events that ultimately leads to heart attacks because the arteries get calcified, they get fragile, the plaque gets fragile, it fractures open and triggers a heart attack. So that can completely be avoided by eating a low glycemic diet on a consistent basis. And I saw a patient today who it's critical for him that he have excellent control of his blood sugar. He has severe peripheral vascular disease. He's that close to losing his foot, and he knows that he has to normalize his blood sugar, and yet he's telling me that his fasting blood sugars are around 130 still, and this is without any medication. So with the dietary history, he's basically breakfast, lunch, supper. It sounds like the perfect eating plan for a low glycemic diet. But then I kept asking him, what else are you eating? What kind of snacks are you eating? He finally fessed up that he's eating chips and other stuff like that in the evening after supper. So he's great from breakfast to supper. Then he's snacking on high glycemic garbage. And this is the stuff that is fueling the destruction of his little arteries. And he's going to lose his foot if he doesn't change his ways. There's just no way around the damage is happening faster than the healing process can happen. The same process is going on in the coronary arteries, only different kind of sequence, but ultimately leads to the same kind of problem, which is the artery plugs up and the person has a major event. And eating low glycemic, very low glycemic, completely eliminates that possibility. It just can't happen if you're not eating the high glycemic foods, because you don't get insulin spikes and you don't get blood sugar spikes. And both of those damage the lining of the arteries. The delicate lining of the arteries, called the endothelium, is damaged by blood sugar spikes and by insulin spikes. Well, so it turns out that these same issues are major risk factors for cancer. And so a lot of the cancers are driven by these same factors. I'm not going to go into the how it happens, just it does happen. And many cancers are linked to these metabolic disorders that we basically do to ourselves, just like the gentleman who's going to lose his foot if he doesn't change what he's doing. We do to ourselves by eating high glycemic garbage when we don't need to, and we've got alternatives. So I want to encourage you that you have control over whether you have a high risk of heart attack or a very, very low risk. And you can markedly decrease your risk for cancer just by eating in a low glycemic fashion. So I hope you found this encouragement helpful. I wish you well. God bless and have a great day.